Order. Order. Shochat Adam to move the motion.
Thank you, Mr. Chair. And can I say it's a real pleasure to serve under your chairship for the first time, Mr. Pritchard. And thanks for everybody, all the members, right honourable members and honourable friends for attending this really important debate today. I'd like to, first of all, declare my registered interest as a practising optometrist at the NHS. And indeed, as an optometrist for many years, I've had the privilege and sometimes the heartbreak of looking into people's eyes whose lives are changing without them even knowing about it. Because fundamentally, that is what glaucoma does. It changes lives quietly and often without warning. That is why last week it was Glaucoma Awareness Week, because many people are indeed not aware of the fact of the condition. And I'd like to, at this point, applaud the work done by Glaucoma UK to raise awareness of this condition, because it is known as the thief of sight for very, very good reasons. Broadly speaking, Mr. Chair, glaucoma damages the optic nerve. And the optic nerve is made of millions of little nerves and bundles, and each part of the nerve represents a single point in our visual fields. And because vision loss begins at the edges, people don't often realise anything is wrong until it's too late. So I would like to give you just two very brief but very real examples from my own experience. First, a woman came into my practice who was hit by a car in her own car from the side, not once but twice. She came in and she read out the very bottom line, the tiniest letters you can see, and she couldn't understand why she kept missing things on the side, and in this case, cars. And it became apparent that she was a quite advanced sufferer of glaucoma, and she had lost majority of her what we call peripheral or side vision. Another very memorable patient was a gentleman coming in, kicking and screaming, brought in by his wife, because he kept knocking off the salt and pepper and the ketchup on the dinner table. And it became apparent again, he could see everything clearly straight ahead, but he really couldn't see anything on the side. And he also had very advanced form of glaucoma. Glaucoma is the leading cause of preventable blindness in this country, with over 700,000 people affected. But the shocking thing is that more than half, that's 350,000 people, are undiagnosed. And they're walking around, driving around, not knowing that they have the condition. This could be one of us, somebody we love, or somebody, in fact, we work with, as was the case of a former Member of Parliament of this parish, Paul Tyler, a Lib Dem member, who was diagnosed at a complete routine eye test. And in his own words, he may not have been able to carry on his duty as a parliamentarian if he hadn't gone for a simple eye test where they detected glaucoma. And 25 years later, he still has his sight preserved.
I thank the honourable member for giving way and congratulate him on securing the debate. Just on the issue of regular eye testing, which he quite rightly alludes to, does he agree with me that while obviously we want to try and see a response from the Minister, if nothing else is achieved from this debate today, but raising awareness of people to do exactly as he has recommended, and all of us recommend regular eye testing to detect conditions like glaucoma, he will have done everyone a service and the rest of us likewise.
Here, here. I thank the honourable member for his intervention, and I couldn't agree more. If that's one thing we can achieve today, we would have achieved a great milestone. In its early stages, Mr. Chair, glaucoma, as I said, has no symptoms, no pain, no warning signs, just a slow, silent theft of vision. By the time it's noticed, the damage is permanent. It's like the fire has gutted the house before even anybody smelt the smoke. And this loss has far-reaching consequences. People lose not only their sight, but also, more importantly, their independence, the ability to drive, the ability to read, cook, or even leave the house. Falls increases, isolation grows, and then comes the emotional and mental health impacts, fear, depression, and loss of identity. So at this point, I would just very quickly like to pay homage to charities like Vista in my constituency, who have offered invaluable support for people living with visual loss. On that note, especially on the fact of depression and identity, I want to share a moment that has stayed with me, Mr. Chair, for a rare condition that many people don't know about as a consequence of vision loss. A woman phoned my clinic deeply distressed. She said that a child was following me around. This is a lady who had been diagnosed with glaucoma. But nobody else can see this child. She was terrified that she was losing her mind. In fact, what she had was a condition called Charles-Bonnet syndrome, a common but under-recognized condition where the brain fills in visual gaps with vivid hallucinations. Many people never mention it, understandably fearful that they'll be labelled as senile or unstable, and say they'll suffer in silence. Esme is a woman who lived with this condition, Charles-Bonnet syndrome, for over a decade of her life, as was haunted by hallucinations she knew weren't real. Her daughter, Judith, now champions awareness through the incredible organisation called Esme's Umbrella. These aren't clinical oddities, these are real human stories, and they are far more common than we even acknowledge. We are now facing a growing crisis, Mr. Chair, and work done by the Association of Optometrists, Primary Eye Care Services and Fight for Sight have shown that glaucoma cases are expected to rise by 22% in the next 10 years and 44% in the next 20 years. That's incredible number of hundreds of thousands or more people needing care, follow-up and support. And yet, we already have the tools to stop this. So I would like to frame this, Mr. Minister, on the three bases of the government's own proposal of how to tackle healthcare. So firstly, from hospital to community. Patients are losing their sight, Minister, not because care doesn't exist, but because the pathway is broken and follow-up is delayed. Just recently, a patient of mine was referred to the hospital and diagnosed with glaucoma. Fine, no problem there. The initial appointment happened without any problems. But the follow-up was postponed. Then the patient missed the appointment. Then the following appointment was postponed again. By the time I saw that patient again, just over a year later, they had lost 2 full lines of their visual acuity chart, the chart that you read when you go to the optician. That is 2 lines that this patient will never, ever get back. That's the difference between reading your letters and not, or being able to see your grandchild smile, or only hearing it. One of the problems, Minister, current waiting list data measures only first-time appointments, not the ongoing care vital to chronic conditions like glaucoma. We need published data on follow-up waiting times because that's where sight is being lost, and it allows patients to make an informed choice in where they would like to have their treatment. And here's the reality. Hospital ophthalmology is the largest outpatient speciality in the NHS. According to the College of Optometrists, with 8.9 million appointments in England in 2023-24, and it cannot carry this load alone. The answer lies in the community. There are over 14,000 qualified optometrists in England, providing more than 13 million eye tests. They are trained, they are regulated, and they're there ready to help. Community glaucoma services led by optometrists have already demonstrated the ability to reduce hospital referrals by up to 79%. If we implement a national integrated regulated program, they could free up 300,000 hospital appointments a year. That's not a one-time saving because glaucoma is a chronic condition. There are reoccurring appointments, so for people who are living with, they're not cured of the condition, they still have to continue for the rest of their life. This shared care will allow faster appointments, earlier diagnosis, less vision loss, and more time, critically, for hospital ophthalmologists to treat more complex cases. And there's also a case of saving the NHS estimated £12 million annually. Wales has already adopted this model. England should do the same. Yet fewer than 1 in 5 areas in England offers this service. It is indeed a postcode lottery, one that punishes the most vulnerable, especially when you consider people from Black and Asian communities are up to 4 times more likely to develop glaucoma and often have least access to care. We need to raise the awareness by creating a statutory framework so everybody knows, from GPs to pharmacists, that you must go to the optometrist for an eye test. A national rollout of a statutory integrated glaucoma pathway. Secondly, from analogue to digital, which is another major obstacle in the lack of digital connectivity. Many optometrists are unable to send digital referrals to local hospitals. Some don't even have access to NHS email, and we still can't access shared patient records. That means crucial information such as medication, medical history and images get lost, delayed or duplicated. This is 2025. It should not be easier to get a takeaway delivered than to refer a patient with a sight-threatening disease. To move forward, we need We need access to NHS email for all primary eye care providers, shared patient records between optometrists, GPs and hospital services, and an efficient two-way electronic referral system. This kind of interoperability is a basic infrastructure, and it would transform the speed, safety and continuity of glaucoma care. Finally, from sickness to prevention. The final and most important pillar is prevention. Regular eye exams are the front line of glaucoma. Of course, I'll give way.
Can I thank the honourable member for Leicester South in getting this debate before parliamentarians, and I just want to say, firstly, I know that he's very passionate about this area. More than 500,000 people suffer from this illness. Would he agree that it's not just about national rollout of getting an understanding of this, but a proactive approach where general practitioners that know certain individuals at a high risk make referrals?
I thank the honourable gentleman for his intervention, and I think you may have read my speech when I wasn't looking. I'm coming to that point in a little while. Because regular eye exams are the front line of glaucoma detection, yet only 1 in 4 people in the UK aren't accessing any form of eye care at all. Minister, I think we should begin with a mandatory sight test for drivers. The UK is the only country in Europe that gives lifelong licences until the age of 70 without requiring an eye exam. Earlier this year, a coroner in Lancashire issued a prevention of future deaths report, linking a fatal crash to undiagnosed sight loss. This is no longer just a health issue, it's actually a public safety one. We can also incentivise eye tests, perhaps through reduced insurance premiums, employer wellbeing programmes or GP-led initiatives. And for those over 40, when glaucoma risks are steep and higher, every routine health check should include a simple question: when did you last have your eyes tested? Finally, we must consider innovation. Most glaucoma patients are prescribed lifelong eye drops, but poor compliance due to, if you can imagine, Mr. Chair, if you're elderly and you're trying to open up a bottle of eye drop, trying to reach it to the eyes, it's very, very difficult, especially through arthritis and tremors, or just difficulty in inserting the drops remains a major, major challenge. There are new options available now. There's one called minimally invasive glaucoma surgery, which is MIGS, can delay or even eliminate the need for drops. So I urge the Minister to explore commissioning MIGS, especially for suitable patients undergoing cataract surgery. Everybody who lives long enough will need to have a cataract operation. And if they're also suffering with glaucoma, we can stop the disease in its tracks before it causes irreversible harms. It is critical that patients with glaucoma who need cataract surgery are able to discuss options with their glaucoma consultant. If cataract surgery is not performed, MIGS, it may eliminate MIGS as an option in the future, during cataract surgery, that is. Finally, the total cost of visual impairment in the UK is now £26.5 billion. This is projected to rise to £33.5 billion by 2032. Glaucoma alone accounts for £750 million, according to the College of Optometrists, and most of this burden falls outside the National Health Service, in lost productivity, in formal care, people having to give up work to look after family who have lost their sight, and a complete diminished quality of life. In fact, 41% of people who were surveyed reported severe financial impact due to sight loss, often followed by depression, anxiety and social withdrawal. This is a silent epidemic, and this all leads to a low score in every index perceivable. But it's not inevitable. We already know what works, we already have the workforce, we already have the technology. What we need now is collaboration from the industry, the optical and ophthalmic industry, and a political will. This will help us shift care from hospitals into the community. This will help us bring eye care into the digital age, and this will help us prevent sickness like glaucoma and save millions of sight in the future. So let us act now while we can still see what's around us. Thank you.
The question is that this House has considered glaucoma awareness. Brian Leishman.
Good afternoon, Mr Pritchard. It is a pleasure to serve under your chairship today, and I extend my thanks to the Honourable Member for Leicester South for securing this important debate. I will say to him right now that I will welcome an intervention when the time comes to help me pronounce the name of the eye operation I had, because I can never say it. Mr Pritchard, I often say that all politics is personal, and that is incredibly apt for me in this debate, because 17 years ago, when I was 25, I was diagnosed with glaucoma. Pre-diagnosis, my knowledge of the condition extended to Edgar Davids, the Dutch footballer who wore what looked like safety goggles when playing because he had glaucoma and couldn't wear contact lenses. Unlike many people's stories, my own glaucoma story is really actually a very fortunate one. Before coming to this place, I was a golf professional, and at the time I was giving lessons to an optician. He offered to gift me a pair of glasses as thanks. I know that sounds a familiar story for a Labour politician, but moving on. He did some tests, including for glaucoma, and commented that my eye pressure was extremely high, in the mid-30s at the time. And within the hour, I was in the ophthalmology clinic at Perth Royal Infirmary, and I was diagnosed with glaucoma. At this point, I would like to say that Dr. Cobb, who became my consultant, saw me at Perth Royal that afternoon and has been absolutely incredible ever since. She explained to me that I really was very lucky because if I had continued undiagnosed, then I would probably have had another decade or so of eyesight, and then I would have woken up one day in my mid-30s and I wouldn't have been able to see. And that then, there would have been nothing she could do for me, as I would have been blind. Totally symptomless and irreversible. They are the real dangers of glaucoma. And realistically, I will do.
I always recall a patient of mine who was diagnosed with glaucoma at a very late stage. She came into the practice with a wad of cash, saying that give me the best glasses and the best lenses that you can give to help me see again. Unfortunately, she had glaucoma, the vision was lost, and there's nothing money could buy.
Thank you to my honourable friend from Leicester South. Not the first time I've heard that, as I will say later on I have another friend who's an optician, and that's something that is a regular occurrence that he said. He's said that many times in his career. Because realistically, you could be in that very position that you don't know you have it until it's too late. Mr. Pritchard, I was prescribed eye drops. I went through a few options with not much success until I ended up on 3 different drops. Bimatoprost, then brinzolamide, and then briminidine. All 3 into my left eye at bedtime and then again the next morning. Then just briminidine into my right eye at bedtime and same again in the next morning. And my right eye only needs the 1 set of drops because it has been operated on. It has had a trabeculectomy. I hope that was close enough. The operation was needed to save my eyesight in my right eye. Basically, it was an operation under general anaesthetic to make an incision in my eyeball to allow pressure to disperse and not attack my optic nerve. An overnight stay in hospital, an eye patch on for a week, no bending over for a fortnight and 4 weeks off work. A good report from Dr. Cobb, eye drops twice a day and twice yearly checkups at hospital since. I really am lucky. As well as my consultant, I would like to record my appreciation to my optician, Eddie Russell of Norman Salmonies, who provides regular checkups in between hospital visits and the outstanding care that his practice provides. All that goes to show, Mr. Pritchard, is that the NHS really is our greatest invention. Personally, I reject the language that the NHS is broken. It's not broken, it's underfunded. The staff deserve more. The staff deserve the very best. And Mr. Pritchard, in concluding, I cannot emphasise enough how important it is to get tested. It could be the difference between retaining your eyesight and not. And honourable members, I would like to thank you for permitting me to share a little bit about my glaucoma journey as it's ongoing, as we know that it's not something that can ever be cured, but we can try and manage its decline somewhat. Thank you very much.
Shannon.
First of all, a real pleasure to serve under your chairship. Second time today, and getting a liking for it. Can I thank the honourable member for Leicester South for leading today's debate on this issue. As my party's health spokesperson, these are issues of great importance to me, and when you look at the statistics, you will understand the prevalence of the issue. You're going to say to the honourable member for Alloa and Greensmouth, I would think it never would be a case where he would be lost for words, no matter what would happen, you know. That's meant in a good way, by the way. That's meant as a compliment. As is Glaucoma Awareness Week, there is no greater time to consider these issues. And I will start by highlighting the scale of the issue in Northern Ireland specifically, because that's the issue that I want to perhaps maybe highlight. Queen's University undertook a study showing us some 3,221 people aged 50 plus. It found a 2.83% glaucoma prevalence, which I understand is normal for the rest of the United Kingdom as well, with around 2/3 undiagnosed. So there is an issue to address those who are undiagnosed. Northern Ireland currently has some 18,000 confirmed glaucoma cases. I've said to the honourable gentleman for Leicester South, and he knows this story. My dad's dead and gone now, but when he was alive, he lost his eyesight to glaucoma. Unfortunately, probably not just as good as managing it, and times passed, and it crept up on him, and he lost his eyesight. So there are many. Now, my dad was very fortunate to have my mother to look after him, and every sense of the word, and they loved each other greatly. So it was never a burden on my mum to look after my dad. So that was really important. I was also fortunate to secure a debate in glaucoma and community optometry just last year. And the honourable member was at it and made a fantastic contribution. His knowledge of optometry and the job that he did before he come here is one that I admire greatly. And when he comes to these debates, he brings that fount of knowledge and experience and examples which we all appreciate. There is such an important link between our opticians and healthcare specialists who will do the treating for eye conditions such as glaucoma. The fact of the matter is that the data from Specsavers at the time highlighted some 30,000 referrals for glaucoma were made in people aged 40 to 60 in 2023. Now, they weren't all diagnosed as such, but the fact was there was some concerns, and then, of course, the treatment for them was able to start. I've got some stats from Northern Ireland, and I want to quote them if I can for the record. In terms of adoption of innovative glaucoma technologies like iStent, for instance, Inject, two of the biggest eye surgery hospitals in the country, Alta Galvin Hospital and Belfast City Hospital, are now routinely offering these combined procedures to comorbid glaucoma and cataract patients, and now the focus is making sure that no glaucoma patients miss out on this opportunity to intervene in glaucoma at this time of routine elective cataract surgery. So the advances are incredible at this moment in time. As of March 2025, just past there, almost 50,000 people were waiting for ophthalmology outpatient appointments in Northern Ireland. It's a massive number, and the Minister back home in the Assembly really needs to take this on. The prevalence of glaucoma in people aged over 50 in Northern Ireland, as I said, is 2 point, which is comparable to other parts of the United Kingdom and indeed other parts of Europe as well. So the figures we have seem to be relevant to wherever we are in the United Kingdom, but also across the whole of Europe. Interestingly, around 2/3 of people with glaucoma were not aware of their glaucoma, as the Honourable Gentleman and his introduction referred to, which is generalisable from the study sample for the whole population as higher than in other comparable populations. And glaucoma is the second most common reason for certification as sight impaired or severely sight impaired in Northern Ireland. On average, 13.1% of certifications are because of glaucoma, and this varies a lot later on in the year. But I wanted to really say to the Minister the things that we're doing in Northern Ireland in relation to the iStent Inject as a massive technological, medical, modern way forward, and it's really good to be able to report that to this debate today. Like most conditions, absolutely.
I in a giving way. The government in the 10-year plan wants to invest in the NHS, bring services into the community. And there are examples around our country and maybe in Northern Ireland. Trusts in London have diagnostic hubs that better manage glaucoma. And there are regions with community glaucoma services that have reported halving hospital referrals and improving access and saving millions. And there are also pilots like the one in Royal Devon's Nightingale model that reduce appointments from 2 hours to 30 minutes. So would he agree with me that investing and reorganising and having a joined-up service with advanced detection will actually save money and save sight for people and the government?
I thank my honourable friend for that intervention. He's absolutely right, and to be fair to the honourable gentleman for Leicester West when he did the debate. He was very clear that there's an opportunity to advance greatly under the 10-year NHS plan to solve the problems, but first of all in time, but secondly in a better way of doing it, and to reduce those who are waiting. We're very fortunate to have the two hospitals in Northern Ireland, Glaucoma Hospital and Belfast City Hospital, as two examples where that new treatment is starting, but also where cataract operations can take place. And the cataract operations also take place in Down Hospital, just outside of my constituency, further down. Optometrists have a key role to play because they can spot the early signs of glaucoma during routine tests. For patients with stable glaucoma, optometrists have a role in monitoring eye health and helping them to manage their condition. Ahead of this debate, I've been in touch with Glaukos on the steps that can be taken both nationally and within the devolved administrations to improve the outcomes for those diagnosed with glaucoma. The Honourable Gentleman is just left now, but in that intervention he made, it's very clear that there is a great advancement potentially for glaucoma and for eye care as well, and doing things better. They've educated me on the eye stent injects, which are implanted during cataract surgery or as a standalone procedure. The very things I think the Honourable Gentleman, to be fair, from Leicester West referred to. These little stents and block drainage, lower eye pressure with minimal risk or cost, and perhaps this is something the Minister could commit to looking at and engaging with as a means of treatment with those with glaucoma. The Minister is always well versed on the technologies and the advances, and I know when he replies to us all, he will give us some encouragement in relation to that. And also, I should say, I'm very pleased to see the Shadow Minister in his place. I love doing debates with the Shadow Minister, to be honest with you. He and I share that compassion and that passion for the subject matter, and he brings that wealth of knowledge to these debates, and I thank him for that. So to conclude, Mr. Chairman, there are thousands and thousands of people today living with this condition, but there will be thousands more to come, and that's what we want to try and address. Ensuring affordable and accessible treatment is imperative, and as I previously stated, and as the Honourable Gentleman who had reduced the debate has stated, we must not underestimate the impact that our local opticians in particular have in detecting these kinds of issues early on, and I therefore urge people out there to prioritise their eye health whilst they can. Thanks so much.
Irene Campbell.
Thank you, Mr Pritchard. It's a pleasure to serve under your chairship. I would like to thank the Honourable Member for Leicester South for securing this important debate on glaucoma. In my previous role in the NHS, I was part of a working group made up of consultants, GPs, high street optometrists and others, and the group was set up to create a primary care eye care service in NHS Ayrshire and Arran. An eye care Ayrshire was set up as part of a redirection strategy to ensure people were accessing services most appropriate to their symptoms. It promotes that the best person to see for minor eye problems is a local optometrist, high street optician, rather than attending a GP or A&E. The service has been very successful and continues to operate. And really importantly, it directs people to go to the optometrist, and this can be vital if there are any other underlying or undiagnosed eye conditions. As we have heard today, early intervention can be crucial. And last week I attended the event hosted by the Honourable Member for Torbay with Glaucoma UK and Glaukos, which did a great job at raising awareness of one of the leading causes of irreversible blindness. And as we have heard, there are over 700,000 people living with glaucoma in the UK, yet over half do not know it. And the prediction is to rise by 44% over the next 20 years. It is vital that we embrace early intervention and improve access to services and treatment before serious deterioration. By 2050, the cost of blindness is estimated to be £33.5 billion, putting immense pressure on the NHS as well as those suffering from blindness. There are treatment options, as we've heard today, for those suffering from glaucoma, including eye drops, laser treatments or traditional surgery. And Glaucoma UK recommended that optometrists receive improved education and training on combining these procedures to make sure patients are getting the best care possible. It's also important to acknowledge the disparity of services across the UK. In NHS Ayrshire and Arran, the total number of people living with sight loss is 1,000 over the national average. That is obviously a real concern. We need to make sure that people are aware of the need to have routine check-ups as well as the services that are available to them. Over the years, there have been many redirection campaigns to highlight services, and it may be time for reintroduction of this approach. And I know from my experience in the NHS that identifying these diseases early is key to preventing them from becoming much worse. And I encourage the Government today to consider the recommendations highlighted.
Very much, Mr Pritchard. It's a pleasure to serve with you in the chair. And can I start by thanking the Honourable Member for Leicester South for securing this important debate and raising awareness of a life-changing condition in Glaucoma Awareness Week. The Honourable Member for Alloa and Grangemouth outlined his personal experience, and I thank him for that, and particularly the fact that the condition is symptomless in its early stages and that regular checking is so important. The Honourable Member for Strangford also shared the experience of his dad, and I thank him for that as well. And the Honourable Member for North Ayrshire and Arran has brought her own NHS expertise to the debate, and so I feel slightly underqualified, if I'm completely honest, to be speaking in this debate. Ironically, given that we're talking about eyesight, I haven't printed out my speech in a larger font, so please do bear with me. Millions of people across the country are affected by sight loss, and hundreds of thousands of people, as we've heard today, have glaucoma. If untreated, glaucoma can have a profoundly detrimental effect on people's quality of life and long-term health. Yet 1 in every 10 people on an NHS waiting list is waiting for their first ophthalmology appointment. Waiting lists for ophthalmology care grew longer and longer under the last Conservative government, who oversaw a doubling of waiting times in England alone. Meanwhile, more than 500,000 people are waiting now for follow-up appointments. As our population continues to age, this demand is only likely to increase. And like so many conditions, as we've heard today, early intervention is key. One elderly patient in my constituency was sent for an urgent referral following a routine eye test. He was warned that if he wasn't seen in the next few weeks, he was at risk of losing the sight in the affected eye. The appointment came through in time, only to be cancelled, along with the replacement appointment. By the time he was able to see a specialist, it was too late, and he lost the sight in that eye. This was an entirely avoidable incident and demonstrates that it's crucial that we address the chronic shortage of ophthalmologists to deliver the care that people deserve. A starting point would be to deal with the broken system of training, which sees far too few specialist training spaces offered, despite many graduates being really keen to work in the field. A little over a decade ago, there were 4.5 applicants per training place, and that has surged to 10 applicants per place, and that's simply not good enough. So I wonder if the Minister might set out how the Government will deliver the ophthalmology workforce we need, and in particular, will the Government look to reduce the extraordinary shortage of specialist training places in this and indeed other specialties? Will the Government also consider publishing waiting list data for follow-up care? Transparency over waiting lists for follow-up appointments, and not just their initial referral, would help patients make informed choices over the care they need and help properly illustrate the postcode lottery that exists when it comes to eye care in the NHS as things stand. Liberal Democrats also know that fixing the front door of our NHS is crucial to achieving better outcomes on glaucoma and all conditions impacting sight. This means sorting out primary care and community services. So I was pleased to see the Government agreeing with this aim in the 10-year plan published last week. Fixing primary care means investing in local GP surgeries and giving everyone the right to see a GP within 7 days or 24 hours if they're in urgent need, and providing 8,000 more GPs to deliver this. It means ensuring everyone over the age of 70 and everyone with a long-term condition has access to a named GP. And as the member for Leicester South reminded me in our Opposition Day debate on primary care back in the autumn, optometry is a critical part of primary care, and it needs to be delivered locally as well. For glaucoma specifically, it means investing in eye services in the community and empowering training, trusted, qualified optometrists to manage this condition. Optometrists are already in place to manage glaucoma across Wales and Scotland, so we have a strong base of evidence to inform this work. And existing research has suggested that the additional training required is rewarding both for optometrists and the ophthalmologists training them, and more importantly, for the patients they're treating. But in England, glaucoma services vary drastically depending on which integrated care board area you live in. And with major organisational changes underway to that ICB structure, this could be an opportunity to standardise a better, consistent, community-focused approach. So will the Minister set out how the Government will encourage true partnership between qualified optometrists and ophthalmologists, delivering care in the community wherever possible, And can the Minister set out what hurdles they've identified as standing in the way of such an arrangement? Now, finally, we need to ensure the highest possible uptake of eye tests regularly so that we can catch the condition early and prevent damages to people's sight. As somebody who has a close relative with glaucoma, I have my eye test done regularly. It's not too unpleasant, and I know that it gives me the assurance I need that I am not developing that condition at the moment as well. The number of sight tests still hasn't recovered since the pandemic, including domiciliary visits. So given the scale of the challenges on ensuring people are tested, of treating them when glaucoma is found, and of training sufficient staff in a context of surging demand, the government should produce a dedicated eye health strategy, as advocated by groups like the Thomas Pocklington Trust. There clearly needs to be substantial work across the sector to strengthen eye care as part of primary care and better incorporate optometrists to repair a broken training arrangement and to ensure people get the eye test they need. Thank you.
Thank you, Chair, and it's a pleasure to serve under you, Mr Pritchard. And can I, too, thank the member for Leicester South, a colleague in my area as well, but also a primary care colleague in this basis. And his powerful testimonies about patients and what they suffer is exactly why he's an asset to this House when he's presenting the information that we all need to hear when it comes to trying to debate health issues. The member, honourable member across the way spoke about the Perth Royal and how fantastic they were. It's lovely to hear a success story. We don't hear enough of success stories in the NHS because actually the good news, despite what we hear in this place, is the NHS broadly does a fantastic job for many patients, and we should never forget that. He is what we want to see up and down the country when it comes to dealing with glaucoma. And the member for Strangford, he, if anything, is not tenacious and consistent, because I believe when I checked the records, it was him who tabled this debate about it a year ago in April, when he was again raising this cause to make sure that it is heard. And so he's a credit to his party and indeed the people he represents when it comes to raising health issues. And finally, my Scottish colleague across the way talked about NHS working groups, and I have worked in places where we've had PAIRS schemes, so primary eye care acute referral schemes that GPs can use. Patients love them, GPs love them, and I think the opticians and those who work in the services love them too, because it allows that better joined up care, which is where we all want to get to. And I think when it comes to dealing with glaucoma, glaucoma is actually a spectrum of conditions that comes together. We've got ocular hypertension, which accounts for about 3 to 5% of people in the UK over 40. We've got primary open angle glaucoma, affecting about 2% of people in the UK older than 40. But that actually, when you break it down, affects 1% of people aged 40, 3% of people aged 60, and about 8% of people aged 80. Now, with a growing population that's becoming more elderly, we can see why this is a problem. And then we have primary angle closure glaucoma, which is about 0.4%. There are some rarer ones as well to talk about, but I think for this point, the emphasis is here is that actually, as we've heard, it accounts for about 700,000 people who are going to potentially go blind. And as this is pointed out by the Association of Optometrists, and this is their call to the Minister, and I think it's a simple one, is the government considering the call to commission a national glaucoma pathway? And I'd ask him to think about that and potentially answer that question. Because when it does come to dealing with glaucoma, NICE guidance is actually very, very clear, and it states, if any of the following risk factors for glaucoma are present, consider advising people to have their eyes examined by an optometrist. If they're older age, people 60 years of age or older should examine every 2 years until they are 70 of age, when they should be examined annually. Free examination is available through the NHS. Family history of glaucoma. People older than 40 years of age who have first-degree relatives, parents, sibling or child with open-angle glaucoma should be examined annually. Free examination is available through the NHS. We've then got our ethnicity. People over the age of 40 who are black, African family origin should be examined, and there are certain people who are entitled to NHS-funded eye examinations by optometrists. These are people with the family history we've talked about, if you're 60 or over, in receipt of certain benefits, or have been advised to have that follow-up by an ophthalmologist, which is really important, as we've heard today when we're talking about awareness. Get your eyes checked, check your availability, and make sure if you're 60 or over, you understand you can get your eyes checked. But this debate was actually raised, Mr Pritchard, at the end of April in 2024, just a few weeks before the election. And it's worth looking at what the Shadow Minister then said, who became the Health Minister. I quote, "I have a great deal of frustration with the government's approach to this issue. Given the statistics, I would like to see the Minister commit today to turbocharge access to ophthalmology services and make eye tests more commonplace for people who do not have routine tests for their eyes, but also to get people access to eye care services once conditions have been diagnosed." And he closed the debate, Chair, by saying, "We will support the government in the remaining weeks or months that they have to get this policy right. But mark my words, the next Labour government sees this as a priority and we will act." Well, now we're 1 year on into a government. It's worth checking the record to see that priority given. So forgive me for being a bit of a pedant. I went to check Hansard to see how many times this was mentioned. And there are 4 mentions of glaucoma since the election. And only 2 in the context of health. 1 by the member of South Leicester in June last month, and 1 by the member for Strangford, when he was talking in a debate on rare retinal disease. Now, to me, this doesn't seem like it's in keeping with a priority, and I am being a little bit of a pedant, but I also looked through the 10-year plan again to see if there were mentions there. There are 2 mentions of eye care, 1 of ophthalmology and 1 of optometrists. Now, the Minister will argue this is a strategy document, but it does bode the question, what is the plan for glaucoma? Because the last government concentrated on several areas: early detection and community optometry, through emphasising the importance of routine tests, £5 million annually for sight tests and optical vouchers, over 12.5 million NHS sight tests provided free of charge, a budget that was demand-led, not limited by volumes, and public encouraged to get tests through campaigns, social media-based advertising too. When it came to integrated care boards, there was expanding of local services for minor and urgent eye cares, pre- and post-cataract checks, glaucoma referral filtering, and then, of course, the post-COVID backlog recovery, which had £8 billion put to it. Now, I'm getting death stares from the Chair, so I will move on to the main points and the questions that I have for the Minister.
Sorry, the Shadow Minister could be brief. It's 5 minutes. I gave 6 to the Liberal Democrat spokesman. I'm going to give you, the Honourable Gentleman, another 30 seconds.
30 seconds.
Yeah.
Is there a plan on the strategy for a consideration of a pathway when it comes to glaucoma? Will the workforce be committed to as well? And the plan that, as it stands, as pointed out by the HSJ, has no delivery chapter. Where is the delivery chapter for the 10-year health plan? I'm grateful, Chair.
Thank you. It's important that the Chair is both neutral and fair in the distribution of time, just to be clear on that. So, Minister.
Well, thank you very much indeed, Mr Pritchard, and it's a real pleasure to serve under your chairship today. And I'd like to thank the Honourable Member for Leicester South for bringing forward this important debate to raise awareness of glaucoma. I did enjoy our meeting some time ago, and we discussed this issue and other related issues at length, and are certainly keen to ensure that we keep that dialogue going, not just in this debating chamber. It's very timely, this debate, following Glaucoma Awareness Week, which ran from the 30th of June to the 6th of July. Losing one's eyesight can be devastating, and I pay tribute to the charities who do so much to help people living with glaucoma or to research a cure. Glaucoma UK, the Glaucoma Foundation and the Royal Institute for Blind People, to name just a few. Last week, the Prime Minister set out our plan to get the NHS back on its feet and fit for the future. Underpinning our plan is the 3 big shifts: from hospital to community, from analogue to digital, and from sickness to prevention. The plan was developed through extensive engagement with the public, patients and staff, including the eye care sector. All 3 of the shifts are relevant to preventing and managing conditions, such as glaucoma, in all parts of the country. More tests and scans delivered in the community and better joint working between services will support the management of conditions, including glaucoma, closer to home. Turning to glaucoma detection, this government takes glaucoma very seriously as one of the main causes of sight loss. It's a time-sensitive condition in which early detection and treatment can help slow or prevent vision loss. I want to acknowledge the vital role played by community optometry in preventing people's eye health across people's eye health across the country. This includes the member for Leicester South, who of course is an optometrist and has significant expertise in this sector. And I would also like to pay tribute to all of the honourable members who've contributed to this debate with such passion and conviction. Sight tests play a vital role in the early detection of glaucoma. Most glaucoma patients are identified through routine sight tests. You cannot feel glaucoma. It doesn't cause any symptoms, and the eye pressure doesn't always cause any pain. That's why regular sight tests are so essential, so problems such as glaucoma can be diagnosed and treated as early as possible. It's recommended that everyone should have a sight test every 2 years and more often if considered clinically necessary. The NHS invests over £600 million annually into providing sight tests and optical vouchers, and high street opticians deliver over 13 million NHS sight tests annually free of charge to eligible patients. NHS sight tests are widely available across the country for millions of people, and those who are entitled to them include children, individuals over 60, individuals on income-related benefits, individuals diagnosed with glaucoma, or considered to be at risk of glaucoma. Now, we understand that some people may not prioritise sight tests compared to other healthcare, or they might not know that these are recommended every 2 years. That's why we're always looking for opportunities to remind the public through social media. I was pleased that Department supported Glaucoma Awareness Week and that the importance of regular sight tests through our social media platform last week. I'd also like to take this opportunity to urge anyone who might be watching this debate to visit your optician if you've not had a sight test in the last 2 years. Please check on the NHS website if you are eligible for any help in paying for a test. NHS sight test providers in the High Street also display information about NHS sight test eligibility. Now, some High Street optical practices are also being commissioned by integrated care boards to provide glaucoma referral refinement services. Moving more care into the community is one of the key priorities from our 10-year plan. We want to see care happening as locally as possible for patients. Where a patient's been identified with raised eye pressures, local glaucoma referral refinement schemes provide additional tests to confirm whether a referral into secondary care is absolutely necessary. These can save patients time and worry, reduce unnecessary referrals, while freeing up space for others who need specialist attention in hospital. Over 70% of ICBs currently have some coverage of referral refinement in place. For those patients that do need to be seen in secondary care, it's vital that they have access to timely diagnosis and any clinical necessary treatment. We have wasted no time in getting to work cutting NHS waiting lists and ensuring people have the best possible experience during their care. We promised change, and we've delivered early, with a reduction in the list of over 230,000 pathways, including ophthalmology, where the waiting list has been reduced by over 24,000 patients since July 2024. It's fallen from 606,819 to 582,385 as of February 2025. In addition, we've exceeded our pledge to deliver an additional 2 million operations, scans and appointments, having now delivered over 4 million additional appointments. I will.
He'll probably be aware of the Full Fact and Sky News report, which looked at the speed at which appointments are delivered. The government has indeed delivered 4 million appointments, but under the last Conservative government, it was 5 million appointments in that same time. So we're actually seeing a slowdown in appointments. How is that going to affect people with eye conditions or other health conditions?
Minister.
Well, I thank him for that intervention. We, of course, in our manifesto set a target of 2 million additional appointments within the first year of a Labour government, and we've delivered 4 million. The key is to ensure that we are getting people off the waiting list. So I don't know the 5 million number that he referred to. I don't know whether that perhaps there was more activity, but it somehow wasn't helping to reduce the waiting list, because of course we saw the waiting lists rising consistently. The key metric is, of course, is the waiting list being reduced? And I am very pleased to say that when it comes to eye care, that reduction of 24,000 patients has been delivered since July 2024. So this marks a vital first step to delivering on the commitment that 92% of patients will wait no longer than 18 weeks from referral to consultant-led treatment in line with the NHS constitutional standard by March 2029. In addition to progress made to reduce waiting lists, we recognise the challenges facing ophthalmology services as one of the largest outpatient specialties in the NHS, with demand only set to increase due to an ageing population. NHS England have worked with 11 ICBs to test a new way of delivering eye care, which aims to reduce pressure on hospital eye services. It is also emblematic of our shift from analogue to digital, as it uses IT connectivity between primary and secondary care services to improve the referral and triage of patients, with patient data and images being assessed by clinicians to determine if patients need an appointment in secondary care. It's called the single point of access approach. The SPOA reduces unnecessary hospital appointments, reduces the time from referral to treatment, and allows more patients to be managed in the community. The ICBs testing this SPOA model have consistently demonstrated a reduction in unnecessary secondary care appointments and a significant reduction in wait times, both in time to treatment and to follow-up care. NHS England are continuing to share the learning from the accelerator sites for the SPOA with ICBs. I want to see more ICBs adopting this approach for the benefit of patients, including those with suspected or diagnosed glaucoma. I believe that the SPOA has tremendous unharnessed potential and really is a great example of how, by harnessing technology, we can improve the way the overall system works and facilitate that interface between primary and secondary care, which, as we know, is at the heart of so many of the challenges that we face across our health and care system. Looking at the from sickness to prevention shift, although glaucoma can't be cured, if caught early, treatment can prevent sight loss. The National Institute for Health and Care Excellence plays a crucial role in evaluating new medicines, medical devices and other technologies to determine their clinical and cost effectiveness before recommending them for NHS use. NICE has published a guideline on the diagnosis and management of glaucoma. They have also published interventional procedures guidance that can provide recommendations on whether glaucoma-related procedures are safe and effective enough for wider use within the NHS. There are a number of treatments available for glaucoma, including eye drops, laser treatment or surgery, which aim to lower eye pressure and prevent or slow down optic nerve damage to reduce the risk of sight loss. Although there are treatments for glaucoma, it is a lifelong condition that will require regular monitoring. Historically, this has taken place in hospital. In line with our aim to move more care from hospital to community, there is no reason why, when clinically appropriate, this activity could not be undertaken outside of hospital. And we know that some ICBs are already commissioning glaucoma monitoring in the community. We must also recognise that glaucoma diagnosed late can sadly lead to irreversible sight loss. I know that the Honourable Gentleman for Leicester South speaks passionately from clinical experience about the significant impact sight loss can have on an individual. Emotional support is therefore vital. There are various resources which aim to improve the support, including mental health support, available to patients through their sight loss journey. This includes NHS England's Patient Support Toolkit for Commissioners and Providers and the RNIB's Patient Support Pathway published in 2023. This sits alongside talking therapies or psychological therapies which are widely available and patients can refer themselves directly. We're also taking steps to update the Certificate of Visual Impairment form to improve the signposting of patients to local support services. Finally, I want to recognise the potential for research and innovation to help us understand sight loss and develop new treatments, including for glaucoma. The Department for Health and Social Care funds eye care research through the National Institute for Health and Care Research. NIHR infrastructure funding provides investment in research expertise, specialist facilities, a research workforce and services which help to support and deliver research studies through a range of clinical areas, including eye care research. This includes the NIHR Moorfields Biomedical Research Centre, which received funding of almost £22 million for 5 years from the 1st of December 22, and is solely dedicated to eye care research. The Moorfields BRC has been key in advancing research through a range of studies and clinical innovations in the glaucoma field. One of their flagship projects is a large-scale trial investigating the use of vitamin B3 to slow the progression of glaucoma. Recruitment for this study is ongoing at multiple sites across England. So, Mr. Pritchard, as I have set out, the government takes glaucoma extremely seriously. Community optometry continues to play a vital role in preventing glaucoma, and we are committed to improving eye care services, patient outcomes, and reducing avoidable sight loss, and in particular harnessing the power of technology to drive this forward. I also hope that this debate has further helped to raise awareness and may prompt a few more sight tests as a result. And I once again congratulate the Honourable Member for Leicester South on securing this important debate. Thank you, sir.
Shochet Adam to wind up.
I'd like to take this opportunity to thank you once again, Mr. Chair, and it's been a real pleasure to serve under your chairship. I'd like to thank each and every member and honourable member for their contribution, and I think we've achieved the first objective, which was to raise awareness for glaucoma, and I think we should keep the continuation of the conversation going. As my honourable friend and my neighbour from Hinckley and Bosworth said, we've got an ageing population. There will be very soon, if nothing is done, over 500,000 people walking around with this condition. And that's why it was very pleasing to hear the Minister even remembering our meeting, which was very early on in our tenure, and I can assure him that we'll be continuing to have that meeting every time he sees me about eye health. And I'd also like to take this opportunity to thank the people in the gallery. We've got people from the Worshipful Spectacle Makers, the General Optical Council, the College of Optometrists, and Glaukos, and my apologies if I've forgotten anybody there. I think primarily we must utilise optometry as a primary eye care provider that it is, and treat it as such in equivalence to how we treat our GPs and pharmacy colleagues. We need a statutory framework regulated for the whole detection, monitoring and treating glaucoma. And I think working collectively together with the optical and ophthalmic bodies and government, we can surely do our best to prevent people with preventable sight loss and the devastating impact that has on their lives. Thank you very much.
The question is that this House has considered glaucoma awareness. As many of the opinions say aye. Contrary, no. I think the ayes have it. The ayes have it. Order, order. The sitting now stands adjourned. Order, order. Have a good evening. Thank you.